This video is over the glossopharyngeal and vagus nerve screening. Objectives. By the end of this video, one should be able to describe the function of cranial nerves, inform viewers how to perform glossopharyngeal vagus nerve screenings, describe causes of cranial nerve damage, describe signs of glossopharyngeal and vagus nerve damage, and also describe treatment options for glossopharyngeal and vagus nerve damage. Cranial nerves. There are a total of 12 cranial nerves in the human body. These cranial nerves are important in relaying information from the brain to the rest of the body. Damage of these nerves can result in specific loss of sensory or motor functions. Causes of cranial nerve damage. There can be many different causes of cranial nerve damage. However, below are four common ones. A TBI, a traumatic brain injury, for example, could be caused in a car accident. Also, tumors and infections. Infections can be caused by shingles or other diseases. And also, drugs and toxins can be harmful to cranial nerves. The glossopharyngeal and vagus nerve. The glossopharyngeal nerve has both sensory and motor components. The sensory component is responsible for detecting a bitter taste on the posterior aspect of the tongue. The motor component is responsible for swallowing and speaking. The vagus nerve also has sensory and motor components. The sensory components have to do with the larynx, and the motor components also have to do with swallowing and speaking. That is why the glossopharyngeal and vagus nerve are commonly screened together. Screening of glossopharyngeal and vagus nerve. Sensory screening of glossopharyngeal nerve. The first step is you're going to ask the patient to have a seat. Next, you can give the patient a bitter solution and ask them to eat it. Then you ask the patient if they can detect the taste. If the patient has difficulty finding words, you can give them examples and ask them if the solution is either sweet, salty, or bitter. Motor screening of the glossopharyngeal and vagus nerve. Below are four examples of how to screen for them. 1. Elicit a gag reflex by swiping a tongue depressor or cotton swab near the back of the throat. Be sure and do that on both sides of the throat. You can observe the patient's ability to swallow. You can ask the patient to speak and see if they speak clearly. And also you can check and see if the patient's voice is hoarse or if they have difficulty breathing. The following is a short video to give a visual example of how to complete the motor and sensory screening.
Cranial nerves play a vital role in helping us function as humans. When there is damage to one or some of the nerves, it can lead to detrimental effects. In this video, I will be testing cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10, the vagus nerve. The glossopharyngeal nerve contains both sensory and motor functions. However, for testing purposes, I will just be observing the sensory component of this nerve. So Brian, go ahead and have a bite. Can you please label if that's sweet, salty, or bitter?
It's bitter.
As you can see, the patient is able to distinguish bitter flavors, which means that the nerve is functioning properly. In the patients with glossopharyngeal nerve problems, the patient will not be able to distinguish bitterness, which stems from the posterior lateral part of the tongue. The next test incorporates the motor functions of both the glossopharyngeal nerve and the vagus nerve. These nerves share similar motor functions and are responsible for the gag reflex and swallow reflex. All right, Brian, can you open your mouth and say ah? As you can see, the patient is showing no difficulties in either area, which means that there is no damage to the motor functions of these nerves. A patient with motor problems of these nerves would display with difficulty swallowing and would not have a gag response to placement of a tongue depressor in the back of their mouth.
So what are different signs of glossopharyngeal and vagus nerve damage? Signs of glossopharyngeal nerve damage could be the loss of bitter taste, which has to do with the sensory component, or dysphagia, and dysphagia is defined as difficulty swallowing. Signs of vagus nerve damage is dyspnea, which is defined as shortness of breath, dysphonia, that can be represented by any voice impairment or difficulty in speaking, and dysphagia, difficulty swallowing. So what are different treatment options for glossopharyngeal and vagus nerve damage? The treatment is going to depend on what symptoms the patient is displaying. So for dysarthria, exercising the palate and the pharynx can be good treatment options. For dysphagia, many interventions that are utilized by OTs are compensatory strategies. So these compensatory strategies can consist of different swallowing strategies or modifying the diet textures and also enhancing feeding skills. And that could be through adaptive equipment. Thank you for watching.